Good afternoon, live from Toronto on the GBKM network. This is the Chat Up Show, the show where we catch you up with the chat up of our weekly headlines. I'm your host, Elizabeth Eloidy, and I hope that you are ready to chat it up with me today. Now, as always, you know you can keep up with the GBKM network in various ways. You can listen and watch live 24/7 at www.gbkm.tv or www.gbkm.fm, where you can catch up on any live shows, past shows, check out our upcoming show schedule, like, share, comment, subscribe, all of that good stuff, and check out our breaking news tab to see what breaking news is going on around the world. You can also download our free app. It's the free GBKM app available for all iOS and Android devices. So make sure you go and download the app because you get all of the features on our web station. You get to watch and listen live. You get to catch up on past shows you may have missed. Check out our upcoming show schedule, learn a little bit more about our on-air personalities, all that good stuff. But every time we go live, you will be notified. So make sure once you download the app, you turn on your notifications so you are notified every time we go live with a show and you won't miss another show again. You can also continue to watch us on Facebook and YouTube at GBKM Network. You can follow us on Instagram and Twitter at GBKM Network as well for more updates on what's going on right here at GBKM. Now, ever since the vaccines have become a topic of conversation, there has been a side piece to that, and that is whether vaccine passports will become mandatory. And for a very long time in our province of Ontario, our premier said that no, he does not want to put out a mandatory need for vaccine passports for certain establishments, that as long as people stay safe and are vaccinated, that's as much as we will need to ensure that the curve of the COVID cases continues to flatten and we don't see as many cases daily. That tune has now changed with our latest update on what's going on in our province, and that the vaccine passport will soon become a reality for us right here in Ontario. And for those of you who are thinking, oh my goodness, for so long, our Premier Ford has said that we won't need a vaccine passport, that this isn't the route that we're going to take, things do change. And as we know now, we are stepping into our new election season. You know that we've only had 36 days of campaigning. Elections will be September 30th. So a lot of leaders of our different parties are wanting to ensure that, you know, their campaigns are heard, their promises are heard. And one of the things that Prime Minister Trudeau said was that Ontario will need to, you know, make a vaccine passport necessary as part of one of his campaign promises that ensures the safety of all Canadians across all provinces. Now, Ontario is, you know, catching up with other provinces like BC who have already made a vaccine passport necessary. Now, in terms of the details and what will come of this new update, there is a press conference that's going on right now, actually, of Premier Ford, who is discussing and sharing for the first time in a while with media personally about what this vaccine passport may look like and how the rollout will be like for Ontarians and for those who, you know, are wondering. Now, from what we do know so far about this vaccine passport is that the program will start going into effect as of September 22nd. And we know that you will need a passport to enter gyms, indoor restaurants, movie theaters, concerts and organized large gatherings, and places where wearing a mask throughout the duration of your visit is not realistic or is not possible. So you would require to enter such establishments to have your vaccine passport. Now, the government sources said on this morning, actually, that Ontario residents would not need the certificate for retail shopping or outdoor patios. This is only for indoor spaces like gyms and indoor restaurants, but for retail purposes, since, you know, for the most part, you can keep your mask on while you're in the mall, while you're grocery shopping. You don't really need to take your mask off, even though some of you were hoping maybe this was an opportunity where you might get some respite from having to wear masks. Not yet. The vaccine certificate will be used alongside a government-issued ID, so a licensed health card, Ontario photo card, even a passport as well. The province is also working on an app that will combine ID and the vaccine certification, which users can now also will then be able to show if asked for proof of your vaccination. Now, this is something that, you know, a lot of people feel that it can be an infringement on privacy. You know, you don't want to share your medical history of any kind. But it's all on the other side, there have been a lot of folks who have been advocating for this, saying that since it's required for us to be vaccinated, since the rate of vaccinations is so integral to our reopening and how we will continue moving forward through this pandemic and trying to move past this pandemic, that maybe to help continue curb the number of cases that we see rising as we go into the colder months, that this will be an opportunity for us to keep those who are unvaccinated safe and also ensure that those who are vaccinated aren't, potentially infecting those who are unvaccinated. Because we do know that majority of the people who are going to hospital, catching COVID and ending up in hospital beds are those who have not received both doses of the vaccines. Now, this, as you can see on the screen right now, this is just the beginning of the press conference that will start shortly, where Premier Ford will address the media and their concerns regarding what this program will look like. Now, it is a two-step program. As I mentioned before, you would first need to show government ID and your proof of vaccination, which is what you received once you got your doses of the vaccine. And then later on, we'll transition into an app where all that information will be in, and you can show that as your proof of vaccination. Now, how this app will work, from what we know, information will be embedded into a personalized QR code as of October. So we know that the vaccine passport, the necessity for having a vaccine passport or the program won't go into effect until September 22nd. So starting from today, that's 21 days, 3 weeks from now. Just so we're not shocked, giving you some time to get, acclimatized to the idea that you will have to show proof in certain places. If you want to go to the gym, the cinema, as I mentioned before, indoor dining, those things, but not for retail shopping as of yet. As we know, these updates are happening quite quickly, and it's happening as we talk about it. We talk about it a lot on the Chat Up Show here. We've talked about it previously, a few months ago. We talked about it last week, how the University Health Network is urging more people to be vaccinated, and it felt like this was the next, progression in how people will be dealing with vaccinated versus unvaccinated folks in public establishments. We talked about last week as well that Edo's governor made it a necessity to have proof of vaccination, and that folks who aren't vaccinated will not be allowed to enter banking establishments, will not be allowed to enter places of worship as well. And who knows if that's where we're going to slowly lead to in Ontario as this program is implemented. But for now, we do know that for gyms, movie theaters, indoor restaurants, not the outdoor patios, places where wearing a mask during the duration of your visit is not realistic or not necessary or impossible, you would be required to show your proof of vaccination with this quote-unquote vaccine passport. So as I mentioned before, by October, the app will be available. So we're using technology to our advantage, much like the other apps that are available, to the tracing app or the ArriveCan app, where when you come back into the country from being abroad, you have to, log in and check in every single day during your quarantine. This is just going to be another app where you to show your proof of vaccination. Now, sources say the government is also developing an app for businesses to verify the contents of the QR code. So when you show your QR code at a certain establishment, they will also have an app to verify whether the information that is, presented in this personalized code is accurate. And that will also be ready in October. Now, it is not yet clear how this will work for people who do not have access to a cell phone, because of course, if you need an app, you will need a cell phone and some sort of internet connection. I'm sure that will be discussed later today when our premier comes before media in this press conference to discuss the inner details of what this vaccine passport program will look like. Now, he will be joined by our Health Minister, Christine Elliott, and Chief Medical Officer of Health, Dr. Kieran Moore, as well during this press conference, just to discuss the, the necessity of having this vaccine passport and why it's important to ensure that people are staying safe and that they are doing their due diligence to ensure that citizens are as safe as possible, whether vaccinated or unvaccinated. Now, for several days now, officials have met multiple times to discuss the details around this Ontario vaccine certification system. I mean, it's been discussed for many, many months. There are other provinces that have already adopted this system. It took our Prime Minister to essentially call on our province and say, hey, There are other provinces that have already adopted this, like Quebec and BC, and even in France as well. Why can't Ontario also start to adopt it, considering Ontario has been a hotspot of the country for a while, and especially here in Toronto and even the Peel region for us, we were hotspots for a while as well. Now, of course, everyone is entitled to their opinion about whether this is fair. Because it would mean that there are certain people who choose not to be vaccinated, they will not be allowed access to certain spaces. Now, this is not what the press conference, I'm sure, will not discuss. It will just go into the details of what this system will look like. But at the back of everybody's mind, you're thinking, how is this fair? How is this possible? When the vaccines were, presented, we've said this before, when they were initially presented, it was a choice. You had a choice. It wasn't like you were being forced to get vaccinated, and people who chose not to be vaccinated could go on and choose not to be vaccinated and continue with their social distancing and wearing masks everywhere they went. But now it's almost becoming like there's not much of a choice, because certain freedoms are being limited, let's say. Not necessarily taken away, just limited. Now, we also know that in terms of number of people who have been vaccinated so far, we're currently at 83% of residents 12 and older in Ontario who have at least one dose of the vaccine, and about 76% that are fully vaccinated. We also know that now folks who are age 12 and older can be vaccinated, as we're going back to school as well. And that's another question that a lot of people had, is that whether you need this vaccine passport to enter school, in school around, how that would look like for students and teachers who are choosing not to be vaccinated. Some are in fear that they will lose their jobs, much like those in the health industry and health sector as well, who are now, according to the UHN, possibly going to lose their jobs if they're unvaccinated. And then adding this vaccine passport system as well, not making it just about employment and now about, our recreational activities, going to the gym, going to the cinema. It's adding to the things that we need to be thinking about moving forward. It's not just, life isn't simple anymore. Before we used to be able to just walk out the house and not worry that we won't be granted access into certain places if we left our mask at home or if we didn't have the vaccine. But now things have changed over the last year. We've seen great changes in how we are socializing and how we are maintaining our social nature as human beings. And this vaccine passport is another example of how we're trying to keep the people safe who have taken, who've made the choice to be vaccinated. But at the same time, it's also realizing that those who are unvaccinated are going to be limited in what they can do. So once that press conference starts, of course, we will try and keep you updated on that. But for now, we also look back to how the initial vaccine passport program was presented, and it was a 3-step process that was supposed to be implemented over 3 months. But, the Ford government had decided not to go with that process and instead went with this 2-step process where initially first you'll just need the proof of vaccination, which you received when you got vaccinated, and a government issued ID, and then to fully be implemented in mid to late October, the 2-step authentication on the app. Now, for the first month, as we said, proof of vaccine will be the receipt issued to you when you vaccination. If you did not keep it, I'm sure you were emailed it. As we see now, Premier Ford on the screen has just entered this press conference to discuss the details of the system. And and then just continuing off of what I was saying before, that later on we will have the app that will, be able to verify using the personalized QR code. Now, people with the app will be able to simply show a screen proving that they have a vaccination status. For those who are wondering how this app will work, a QR code, it's what we've been using. If you go to a restaurant now or you go to an establishment now, you take a picture of the QR code so that you can do the COVID contact tracing system where you put your information so that if you do come in contact with someone who tested positive in that establishment, they can get in contact with you to ensure that you're taking the necessary steps to stay safe by getting tested as soon as you are aware. Now, this is probably the similar system that they're going to use for the verification. Is, businesses will be able to scan the QR code and then be able to verify what is going, whether you have been vaccinated or not. Of course, you probably won't be able to have a personalized QR code unless you are vaccinated and unless you can prove it with the receipt received. So this is a big update that a lot of people have been waiting for, because as we see even on our neighbors down south, that was a possibility that they were toying with in a lot of the states in the United States, that having to show proof of vaccination before entering concerts or festivals or restaurants or cinemas and things like that would be necessary in an attempt to ensure that people are staying safe. As you know, people who are vaccinated can still contract COVID, but the chances of a hospitalization, there we go, that was a tough word. Hospitalization is significantly lower than if you are unvaccinated, which is why a lot of countries, as we said, even France and even in Edo states, Nigeria, are opting for this proof of vaccination because they think that this is an attempt to ensure that people are staying safe. But you know, we always have to look at the other, like the other hand of it is, if the vaccine is a choice and people's choices and liberties, if you will, are being taken away by not being allowed into certain establishments unless you have proof of your vaccine, or you have your and your government issued ID as well, because you know you need those two for now. You won't be allowed access, you won't be allowed entry, you know, infringing on your freedoms, if you will. But with this press conference now, we will surely hear as to how the Ford government plans to implement this right now. Now, we're talking about all of this, and then it's under the umbrella of the fact that we have federal elections happening at the end of this month. And a lot of folks are wondering if this is part of a campaign ploy, whether this is, you know, part of what Prime Minister Trudeau, why hadn't he, you know, put a heavy hand down before he was on the campaign trail, you know, campaigning for his majority government that he was looking for, which is why we have a 36-day campaign and election season this year, earlier than we were intended to, right? A lot of folks are kind of side-eyeing the situation a little bit, because why is it now all of a sudden that you are now essentially forcing the province that said that they
with their
weren't
medical
going to do this,
experts,
because we know
we've landed
from
on a
previous
vaccine
months,
certificate
Premier
policy
Ford had
that is
maintained
based
that he
on
does not think
evidence
that it's
and best
necessary
advice.
to make a vaccine passport
It's a policy
mandatory,
with the following
and now
key
all of a sudden
principles.
the tune is has
Vaccinations
shifted a little
will be
bit,
mandatory for
and
certain
folks are
indoor
wondering if
settings
that is
where the
an
risk of
issue with,
transmission is highest
elections. Now,
because of
we're gonna
masks
tune
aren't
into
always
exactly
worn,
what
including
Premier Ford is
restaurants,
saying right
bars,
now
and
at the
casinos,
press
among
conference.
others. Enforcement will be led by bylaw officers, will be reasonable, and will rely on individuals and businesses to do the right thing. The policy will not apply to outdoor spaces where we know the risk of spreading COVID is low, except for nightclubs because of the higher risk of these settings. We will accommodate legitimate medical exceptions and will be closely aligned with other provinces that have introduced similar policies while ensuring we design and implement a policy that makes sense for Ontario. These measures will be in place as of September 22nd, and they are intended with one goal in mind: to allow Ontario to keep moving forward safely, to protect our hard-fought progress. And my friends, it's no secret, this is something that I did not want to do. This is a serious step that we're not taking lightly, and I know this is going to be very difficult for some people. And let me be clear, this is a temporary tool that we won't use for a day longer than we have to. But after talking to Dr. Moore, I know that this is what we have to do right now in the face of this fourth wave, because these certificates are necessary to keep our hospitals safe and to avoid another lockdown. This is the right decision for our kids, our businesses, and for all Ontarians. Before I pass it over to Minister Elliott, I want to implore all Ontarians who are not fully vaccinated to do so without delay. These vaccines are safe, they're available, and they are your best protection against this virus. If you have questions, please talk to your doctor, your pharmacist, or primary care provider. Do it for yourself and for everyone else you care about. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. Good afternoon, everyone. Throughout the pandemic, the health and safety of Ontarians has remained our top priority. We've taken a cautious approach to reopening and have taken measures to protect vulnerable Ontarians, including wide-ranging mandatory vaccination policies. We know vaccines provide the best protection against COVID-19 and the Delta variant, and we thank the over 76% of eligible Ontarians who have received both doses of the vaccine. And together with our health system partners, we are continuing our last mile strategy to administer even more first and second doses each day. However, the threat of COVID-19 and the Delta variant remains strong and will continue to pose a risk until we receive and achieve higher vaccination rates. Further action is required to protect Ontarians while they enjoy many activities that are now accessible, while continuing to keep our schools and businesses open and our economy running. That's why, as of September 22nd, Ontarians will need to provide proof of being fully vaccinated in order to access a number of businesses and public settings. This process will occur through 2 steps this fall. Beginning September 22nd, individuals will be required to show their vaccine receipt at the entrance of certain settings along with photo ID. These receipts are currently available as PDFs that can be downloaded or printed. Beginning October 22nd, we will introduce an enhanced vaccine certificate with a unique QR code. This can be kept on your phone to easily and conveniently show that you've been vaccinated when needed. The province will also launch a new app to make it easier for businesses to verify your digital vaccine receipt while protecting your privacy. Our approach will focus on indoor settings with restrictions, including those where there are larger numbers of people and where face coverings can't always be worn. This includes restaurants, bars and nightclubs, gyms, meeting and event spaces, and indoor sporting events. But I want to be clear that at no time will people be denied medical care, food from grocery stores, or basic medical supplies based on their vaccination status. We will also maintain access to these settings to those who have a medical exemption or children who are not yet eligible to receive the vaccine. Our government will not hesitate to protect Ontarians' health and well-being, and this initiative will help manage the 4th wave while also keeping our schools and businesses open. Increasing vaccination rates is the path forward out of this pandemic. So please, if you haven't already done so, get your first and second dose of the vaccine as soon as possible to protect yourself, your loved ones, and our communities. Thank you, and I will now pass it over to Dr. Moore.
Thank you, Minister Elliott. Good afternoon, everyone. Like many other jurisdictions, Ontario is in the midst of the 4th wave of the COVID-19 pandemic. We've seen an increasing number of cases and hospitalizations due to COVID-19, especially amongst those who are not vaccinated. By taking a cautious approach to Ontario's reopening, we've been able to slow the growth of the virus, but it is critical that we continue to respond with assertive action to protect Ontarians from serious illness, hospitalization, and sadly, death. We need to be proactive to avoid reactive closures, and that means looking at best evidence and practices to maintain a strong chain of protection. Proof of vaccination is one such practice that is increasingly being adopted in other jurisdictions to help limit the spread of the virus. British Columbia, Manitoba, and Quebec have all started to implement vaccine credential systems. As we continue our last mile strategy to increase vaccination rates, the introduction of a proof of vaccination policy will help to encourage every eligible Ontarian to get their shot, to keep our communities safe and the province open. Immunization is key to protecting ourselves, our loved ones, and our most vulnerable. And Ontario has developed the most comprehensive and far-ranging vaccination policies in the country. This includes the directive issued on August 17th, mandating vaccination policies in high-risk settings to protect vulnerable patients and staff. We are providing third doses of the COVID-19 vaccine to vulnerable population and have expanded eligibility for the Pfizer vaccine to children born in 2009 or earlier. The province and public health units are implementing many community-based strategies to make the vaccine more conveniently available to every eligible Ontarian. And we will also continue to implement vaccination policies in other congregate, post-secondary, and childcare settings so that every link in our chain of protection is strong. Ontario has one of the highest vaccination rates in the world, and this is key to protecting Ontarians against COVID-19 and the more transmissible Delta variant. But we need to do more. The months ahead will be challenging, and it is vital that everyone eligible to receive both doses of the COVID-19 vaccine do so. A large majority of reported cases, hospitalizations, and death from COVID-19 are in unvaccinated or partially vaccinated people. I am strongly encouraging Ontarians who have not gotten vaccinated to protect themselves and their loved ones. Please roll up your sleeve and please get vaccinated now. Thank you.
We'll go to the phone line for questions. First question, please.
Adrienne Gobriel at CTTV.
Hi, how you doing?
Good afternoon. Question for Premier Ford. Today Quebec announced the beginning of their vaccination plan. They have their QR code. It's all set up. Mm-hmm. You were hesitant to do this for months.
Yep.
Why now? And what do you say to the people of Ontario who are frustrated that it's taken this long and they're going to have to wait until October 22nd to get a QR code?
It's September 22nd. Well, let me just answer your question. There's no secret that, I wasn't in favor of this. Matter of fact, I stood there, a while back and saying I wasn't in favor of it. After sitting down with Dr. Moore, after finding out that the federal government just 3 weeks ago, said they weren't going to have a national passport. Instead, they decided to go with an unnecessary election. We're going to move forward with this, and we have some of the most cautious protocols in the entire country. Thank the frontline healthcare workers. We have some of the highest vaccination rates in the entire world. We continue to have masking policies that other provinces, be it BC and Alberta, BC has 300 times more cases, or 3 times as well, 6 times in Alberta, which equals 600% more cases than we do. So again, I think we've, as a people of Ontario and healthcare workers, have done an incredible job, and we're going to continue doing it and taking every single caution we can to make sure that we have hospital capacity, that we don't have to shut down the economy. We make sure our kids are back in school, make sure the students in colleges and universities are safe, and we're going to do that at all cost.
Follow-up?
Yeah, to clarify, yes, the program begins September 22nd, but the QR codes won't be ready until October 22nd. My follow-up question is this. There's a long list of businesses that are exempt. Salons, retail stores, places of worship, youth sport venues. Mm-hmm. Why leave so many places off the list if one of the reasons for this vaccine certificate is to keep businesses open?
I'll pass that over to Dr. Moore.
I'd like to emphasize that we're trying to be as evidence-based as possible. We're following the data currently available to us in Ontario. I've had regular conversations with medical officers of health in York, in Hamilton, in Windsor, and in Toronto. The venues that we have chosen are responsive to the risk that we've found in Ontario. If the risk increases in other venues, we can add and implement additional measures to protect Ontarians. But this is very responsive, very data-driven, and is based on the risks that currently exist in Ontario, with good feedback from all of the medical officers of health in high-risk jurisdictions where outbreaks are currently occurring.
Next question.
From Lorenda Redekop at CBC News.
Hi there. Thanks for taking our
Hi, Lauren.
questions. First off, on schools, the date that these passports come into effect is weeks after kids go back to school. Why aren't you doing more to prevent community spread to those who can't get vaccinated, knowing that cases are mounting and that we're now in a fourth wave?
Well, we're doing everything we possibly can. Our vaccination rates are, again, one of the highest in the world, highest in Canada and North America. Getting back to school is important. Minister Lecce's done an incredible job making sure we have proper ventilation. We have HEPA filters right across the school system. Increased cleaning. He's done an incredible job, and I have all the confidence in the world in our teachers, our principals, vice principals. They did it last time. We need the kids back in school. We cannot afford to go backwards. We cannot afford to have online classes. The kids need social interaction when it comes to going back to school, and we're going to continue making sure the protocols are in place, that we have a safe environment, not only for the educators, but especially for our teachers.
Follow up?
You had said, and we've also heard from your ministers, that the current system in place to show proof was good enough. Now you are bringing in this QR code, something that we'd heard from many people, them saying that it was necessary. What convinced you that, yes, this was needed?
Well, I'll go back to months. All the premiers, every premier wanted a vaccine passport. And unfortunately, the federal government decided to go to an unnecessary election, which I'm still shaking my head over, in the middle of a fourth wave and a pandemic, and then telling us just 3 weeks ago that they wouldn't be able to get it done till the 24th. Sat down, had a lot of great discussions with our medical professionals, specifically Dr. Moore, and I've always said from the beginning of this pandemic, I follow the medical advice of the Chief Medical Officer in the science. And we haven't wavered from that. And we have two options here. We either do this or we risk shutting down the economy, which would even be worse, having our hospital capacity maxed out and at the brink, having our kids stay at home, our colleges and university kids going back online. That's what we're trying to avoid. And I'm taking the advice of the Chief Medical Officer, as I always have, and we're moving forward when we found out that the federal government could not implement this like every other country and every other leader in the world is doing this. So when you're traveling, imagine traveling around, even Canada, with 13 different vaccination certificates. It would have been much easier if we had one passport, federal passport, we could utilize for traveling, utilize for going into, be it restaurants or other areas. That never happened. We've stepped up, and we're going to make this happen and move forward.
Next question.
From Colin DeMello at CTV News.
Hi, Colin.
Hello, good afternoon. My first question is to the Chief Medical Officer of Health. Hi, Dr. Moore. You had said earlier in the summer that you were expecting a rise in cases in the third week of September after students return to school, but that acceleration seems to have started well before. It already started in August and it's continuing to build. So what are you projecting for September after kids return to school and colleges and universities, and how much of an increase are you expecting from where we are today?
Some of the good news is, Colin, that the number of days for this virus to double is actually increasing. So it was getting shortened down to around 21 days. If you look at the science table data today, it's up to 30 days. So the measures that we've been putting in place that Ontarians are following of masking and hand hygiene and testing and outbreak management are working for us. The policies that we put in play to best protect our colleges and universities, and I wrote a letter of instruction to ensure that all of our colleges and universities in Ontario had immunization policies in play. The vast majority of those colleges and universities have adopted mandatory immunization. That makes those environments safer. We've also worked diligently all summer long with Ministry of Education to ensure we have a safe return of our students. So all of this, we had a heightened risk just a few weeks ago. It's plateauing out, and we'll have to watch as students return. It's not necessarily students in the classroom. I truly do believe we have increased the safety of the classroom through all of the investments we've made over the last several months, and all of the best practices that we've kept in place as compared to other jurisdictions, and the masking that we're going to have, and the testing capacity that we've built. All of those will, I think, ensure a safe reopening, but we're going to monitor that data as colleges go back, universities go back, and students go back, and then make decisions further with government on further reopening. But as you're anticipating, we are putting policies in play, anticipating the risk, and best protecting Ontarians every step of this way, and the government is supporting data-based decision-making.
Follow-up?
Thank you. My next question is to Premier Ford. Hey, Premier, hope you're feeling safe without journalists in the room. We know through our friends at the Toronto Star and the Globe and Mail that you've essentially entered into a non-aggression pact with the federal Liberal leader Justin Trudeau, and that cabinet ministers are forbidden from campaigning for Conservative leader Erin O'Toole. Today, though, you've said a couple of times now that this election is unnecessary. Are you jumping off the sidelines here? Are you getting involved in the federal election?
Yeah, no, I'm not getting involved in the federal election. I have my hands full here. I'm focusing on making sure that we get through this pandemic, making sure that this virus, the Delta virus, we're dealing with the best way we can. And I just want to make sure that we move forward. And you know, I think I've proved to people around Canada and Ontario, I'll work with anyone. I don't care if it's the Liberals, Conservatives, whoever ends up becoming the Prime Minister, I'll be able to work with them.
Next question.
From Rob Ferguson at the Toronto Star.
Hi, Rob.
Please unmute.
Hi, Premier.
Rob.
Sorry, I was slow on getting my phone unmuted. Just wondering what you would say to people who are kind of on the front lines at restaurants, at bars, at nightclubs, at Jays games or whatever, concerts, who have to go over these vax printed out or downloaded certificates and have to calculate whether the people are 2 weeks past their second shot to make sure they qualify to get in. What advice do you have for them? Because there's probably going to be contentious situations where these people might actually have to act like bouncers.
Yeah, no, I hear you, Rob, and that's a great question. We're really relying on the people of Ontario. They've done an incredible job. We have to unite. We have to unite as a province, and I know this isn't easy. Believe me, I know. I'm getting calls and messages. I'm talking to people around the province. This is very, very difficult, but we have two options here. We either continue to move forward in a responsible and very reasonable way, and be proactive, by the way, or if we aren't proactive and we don't take these steps, nothing's worse than shutting down the entire economy, and we're going to do everything we can to make sure that doesn't happen. Making sure that the kids are back in school, making sure our hospital capacity can handle the new cases. I rely on the modeling, I rely on the Chief Medical Officer, and that's the advice I'm getting, and we're going to be very cautious. We want to get through this. I do not want this to go a day longer than we have to, but we have to see what happens when everyone gets back to work, when the kids in colleges and universities get back and the students are back in school. But folks, I know it's difficult, but we have to unite the province, and we will get through this.
Follow-up?
Yes, thanks for that, Premier. And maybe if you don't want to field this next one, I'm welcome to hear from Dr. Moore or Elliott. People who are enforcing this at the gate for...
Rob, we're having some trouble hearing
breaking
you.
up a little bit. Can you try that again, Rob?
Rob, can you ask your question one more time, please?
Sorry, what should people do in a practical sense if they're manning the gates at a Jays game or a restaurant and they do get into a hassle with someone? Should they just call the police? I think I heard you mention earlier perhaps by law enforcement. So what's the solution there? Because it is going to happen.
I know, and I just don't want it to happen. I don't. If people want to get angry, they want to protest, come down to Queen's Park. They can protest, they can do cartwheels, do whatever they want down here. But please, these people are just trying to earn a living. They're just trying to do their job. You know what's so sad about this whole situation, Rob? You know, this virus, you know, it has split up friendships. It has divided coworkers. It has divided families. That's the hardest thing I deal with. You know, it's heart-wrenching. And we need to stay united. United, we're a lot stronger than we are when we're divided. And maybe Dr. Moore, if you want to add anything to that.
No, Premier, I think that's wise advice to Ontarians. We have to stay kind and caring and compassionate. I think the vast majority of Ontarians are following all the rules. 83% of us who are eligible have had our first doses. The vast majority of people are going to be very compliant. There's always a 1 or 2% that'll be noisy. We're trying to avoid confrontation. We're trying to be reasonable and prudent. I believe this will be implemented fairly quickly and efficiently, and we'll move on to the QR code so there won't be those types of one-to-one interactions. So there will be a transition time that could be difficult, but I do believe the vast majority of us won't have an issue with this. We'll be kind and caring and compassionate, and we'll do all the things we've done in the last year and a half. Continue to get tested if we have symptoms, continue to wear our masks, continue to wash our hands, and continue to protect one another.
Next question.
From Holly Mackenzie-Souter at the Canadian Press.
Hi, Premier. This question
Holly.
for you and maybe Dr. Moore if you want to answer. I understand that these vaccine certificate rules don't apply to staff in the new venues, but it's still a stricter policy than what applies to long-term care homes and schools where unvaccinated people can take a test to attend. So can you just explain why an unvaccinated person can work every day in a long-term care home but won't be allowed into a nightclub? Like, why are the rules more strict in these non-essential settings?
Well, thanks so much for that, Holly. I better hand it over to Dr. Moore with that one. Thank you.
So our initial instruction from the Minister of Long-Term Care was instruction on be vaccinated or medical exemption or education or test. That instruction will be opened in that if there's a risk assessment that they haven't achieved the vaccination record or rate amongst their workers that they want, that they can expand it to a mandatory. As you've heard, many hospitals have done that same risk assessment for children's hospitals that serve children that can't be immunized. They have mandated immunization. So we have had a progressive approach to immunization policies in this province, some of the strongest in the world, and we will move to mandatory if and when we're not achieving the goals that we want to protect patients, children, and vulnerables in our community.
Follow-up?
Yeah, thanks for that. Follow-up just for Premier Ford. I mean, this is the first time we've heard you take questions from the media in over a month, and just wondering if this does have anything to do with the federal election or not wanting to impact the federal Conservative campaign. Just wondering if you can address that and kind of why not take questions in so long when there's a lot going on in the province with the COVID.
Yeah, and thanks for that, Holly. You know, I've been working day in and day out like everyone else has, and I went to Northwestern Ontario. I know I always want to say Ontario doesn't end at the 416 border. I traveled 1,800 kilometers by car, not by plane. We flew into Thunder Bay, and then we got in the car and we went all over Northwestern Ontario. You know, these people need to be heard as well. I was out there meeting just endless amounts of people, taking tours of different areas, and all the way up to Atikokan, to Fort Francis, to Thunder Bay, I went to Alstom, a few other places, went to numerous First Nations communities to discuss what we can do there to support them. And by the way, I'm giving the First Nations communities that hosted us a big shout out. Thank you. They treated us like gold, and I'm very, very grateful, and will always be there for them and have their backs as well. But again, it's about coming together, uniting, making sure we don't forget about anyone. I'm going to continue to go out to the whole region of Ontario. People don't realize until you've traveled how large Ontario is. I was at the end of Yonge Street, and then up there they call it the beginning of Yonge Street, over 1,800 kilometers, and just talking to people, telling them that they aren't forgotten. And I'm going to continue to travel to the southwest, over in the east, and everywhere I possibly can to make sure we're there and listen to the people on the ground. There's two things that you can do, Holly, when you're an elected official. You can either sit in the bubble down here, I call it the bubble, listen to a bunch of politicians or Ontario provincial staff and not give your number to anyone. We've taken a different approach, our family has. I give my phone number to everyone. This phone rings nonstop from people that agree and disagree. I try to get back to as many people as possible. You have thousands of years around the province, and you have better insight. And I'm just strong believer of getting out there and talking to the people. And that's what I'm going to continue to do, no matter if they agree or disagree.
Next question.
From Richard Southern at 680 News.
Hi, Richard.
Hi, Premier. Good afternoon. Thanks for taking my call. I know Holly touched on this, but I didn't get a clear answer. I'm hoping you can address it, Premier, because I think it's an important point. This program you're announcing today will ensure that if I go out to dinner, everybody at my table and the tables around me are vaccinated, but the server that's bringing my dinner to me may not be. Can you tell us why you're not mandating a proof of vaccination for employees, but you are for patrons?
Yeah, excellent question, Richard. I asked the exact same thing. I'm going to pass it over to Dr. Moore and his ideas and philosophy on that.
So any business can introduce an immunization policy for their business and for their employees. And in certain circumstances in Ontario, we have mandated that as a letter of instruction, especially for those that provide healthcare services, but we've also done it now for colleges and universities. The other piece of protection that you have within a restaurant, for example, is that every worker should be screening for symptoms before they show up. They should get tested if they develop any symptoms. They should have the appropriate infection prevention and control equipment to protect them against any transmission of infection. And so there's a whole suite of tools that are there to protect the worker, although obviously my goal would be that they are immunized. If they choose not to be, they are still protected through all those other mechanisms.
Follow up?
Premier, you kept barbers and salons closed for the better part of 7 months because you were worried about the possible infections there, yet they're not included on this list. In addition, if I may, on a two-part follow-up here, you brought up what you called an unnecessary federal election twice today when asked about vaccine certificates. What exactly does the federal election have to do with what's being announced today, sir?
I'll answer that first, then I'll go to the barbers and hairdressers, then I'll pass it to Dr. Moore. The federal election, again, all the provinces, all the premiers have requested a national vaccine passport. It's a lot easier, standardize the system, and then we can utilize that right across the board, no matter if we're traveling abroad or going into a restaurant. It's just so much easier. They neglected to do that. Like other governments around the world, they have a national passport. Then they decided to call the election an unnecessary election at the worst time, in my opinion. You don't call the election during a fourth wave. In saying that, they've done it. Now all the provinces are stepping up, and we're putting together our vaccine certificate. And as for barbers and hair salons, there's no one that got hurt more along with them, many companies, but especially barbers and hairdressers got hurt a lot throughout this pandemic. Things were different 3 months ago. Now we have 83% and growing people vaccinated on their first dose. We have, I believe, close to 76, 77% of the first doses every single day. I get, you know, the sheets that show who's been vaccinated. I'm so happy when I see the first vaccinations are continuing at a rate from 10 to 12,000 every single day. I think close to 30,000 people got vaccinated yesterday. And again, we wouldn't be in this position if it wasn't for the people of Ontario going out there and getting vaccinated. And we wouldn't be here for the healthcare workers that have just worked day in and day out. They're exhausted. And I just want to give them a shout out. I want to thank them. Along with healthcare workers, I put them in the same category, the firefighters, the paramedics, police officers, emergency services. They've done an incredible job. And Dr. Moore, go ahead. Sorry about the...
Good question in the personal service sector. We've done a risk assessment of that sector at present. They've got very good infection prevention control practices both for their workers and for their clients, and their screening that's in place, and their smaller settings. Our biggest concern now going forward with Delta is the high transmissibility and high virulence of it, especially in gatherings where there's large numbers of people. That's where you can have explosive outbreaks. So our risk assessment at present is the bars, the restaurants, the gyms, where we currently are having outbreaks in Ontario. We have strong evidence that we need to have policies in place to protect those environments, to minimize the impact both on the businesses and on individuals by having this policy in play. We will continue to do risk assessments of all of these venues across Ontario in the coming weeks and months, and can expand the list. But at present, we're following data, we're following evidence, and we're putting the policies in place to best protect Ontarians. But we will be relentless in protecting Ontarians going forward, and I certainly hope anyone working in the personal service setting will be immunized given that environment.
Last question.
From Jeff Gray at the Globe and Mail.
Thanks very much. Hi, Premier.
Hi,
I wanted to ask you just, we understand that there was an initial proposal that you had objections to, and the proposal was revised. Can you tell us anything about what was it that you were concerned about with what was initially put forward?
Well, with any proposal throughout this whole pandemic that's come from our provincial staff and our health experts, we always tweak it, we talk about it, and we want to simplify it. We just wanted to make sure it's very easy to get done. We wanted to simplify it, and some folks are probably wondering who this good-looking gentleman at the end, he's Minister Khalid Rashid, that again is the Minister of Digital Government. He's done an incredible job, and this just doesn't happen overnight. I'm not the techie guy. Khalid worked for BlackBerry, very, very smart individual, and has done an incredible job. I'll pass it over to Minister Rashid, and maybe he can talk a little bit about the program that he's put together.
Perfect. Thank you so much, Premier. And absolutely, this program that we are launching, especially the QR code and the app, the provincially designed app, is going to be a very secured and a very privacy protected app. And this will allow users to eventually, businesses to use this app to look at the QR codes and scan individuals to gain them access to their premises. And I think provincially, the team at Ontario Digital Services have been doing a phenomenal job. My team has been working around the clock to make sure that we have a solid product by October 22nd, ready to go.
Follow up?
So just to clarify, there weren't areas, businesses, types of businesses that Dr. Moore or other health officials had recommended should come under this policy that you or other ministers, cabinet ministers, decided should be exempt. Is that right?
That's correct. We just wanted to, again, make it standardized and simplified as possible, and that's what we did. But this isn't uncommon for any policy. You get everyone to look at it, other ministers, cabinet caucus. You get the people within each department to look at it, and you tweak it. and try to make it as easy as possible to get done. And we just want to move forward on this. And I know this is tough, believe me. It is very, very tough. But it's something necessary that we have to do. We have to make sure at all cost, no shutdowns, make sure our schools stay open, and make sure our hospital capacity can handle any influx that we see. And by the way, I'm going to give my right-hand person, a real shout-out, Minister Christine Elliott, that's been shoulder to shoulder with me from day one, working her back off around the clock, making sure that the hospital capacity in ICU is increased. She's done an incredible job since the beginning of this pandemic, and I'm so grateful for her hard work, diligent work, and with her leadership, we're really doing a pretty good job getting through this.
Thanks, everyone.
Thank you, everyone. Stay safe, get vaccinated. Thank you.
And there we have it. There is the end of that press conference with many questions that are answered. Just a few major takeaway points is, for those who are wondering why these particular establishments were targeted first for this initial rollout of this new system, it's because the data showed that these were the places that were higher risk for outbreaks, that there were a lot more outbreaks happening in particular places like gyms, cinemas, restaurants. In terms of employees needing to show their proof, as we heard our Premier and Dr. Kieran Moore say, that they have their necessary systems put in place, that they will be screened coming into work, provided with the necessary PPE, personal protective equipment, to ensure that they are staying safe while they are at their place of employment. Of course, even if you are unvaccinated, there are still other systems in place that will ensure that you can continue working, even though this certificate system is being implemented. Another takeaway is that we obviously do not want another lockdown in Ontario. We want to continue opening businesses and keeping the economy as open as possible, ensuring that schools and universities stay open so kids and students don't have to do online classes anymore like we had to for the last year, essentially. And this system is put in place as another incentive to ensure that people are staying safe, people are getting vaccinated, and we're not going into another lockdown. One thing to take away from this is that this is just the beginning of this system. One thing that Dr. Moore did mention that I'd like to bring some attention to is that if they start noticing that there are other areas that are becoming risks for outbreaks and, becoming hotspot centers, that there might have to be added to the list of establishments that will require proof of vaccination. But for now, what we know is as of September 22nd, we know that it's gyms, nightclubs, bars, restaurants for indoor dining, not the outdoor patios. But, it's getting colder. You're not going to be spending much time on an outdoor patio anymore. These will be the places that will require the proof of vaccine certificate and your photo ID, and later on the QR code that will be implemented towards the end of October. Now, for those who also asked, why now? Why does the Premier feel that it's necessary to implement this now after having such a stance against it in the past? He says, well, he's noticed that he does not want to close the economy again. He does not want to go into another lockdown. We are in our fourth wave. The Delta variant is still very much a risk. There is still a risk of outbreaks and cases climbing, and we're seeing more daily cases. So if this is the next step that is necessary to ensure that the folks in Ontario and in our province are staying safe, then this is the step that they're going to have to take. Now, we know, again, as I mentioned before, as of September 22nd, if you are looking to go to a gym, a nightclub, a bar, indoor dining, cinemas, you will probably need to have been you will need to be double vaccinated, so fully vaccinated with the 2 doses, and have your proof and vaccination certificate to show that you have received the necessary doses. Of course, we will always keep you updated on the GBKM network regarding these updates on what's going on in terms of the pandemic and even the elections. and make sure you continue to stay tuned as more information comes out. But for now, this is what we know. We know that in the next 3 weeks, we're going to start seeing a new normal of having to show proof of vaccinations to enter certain establishments. And with that, that does conclude our Chat Up show for today. As always, you know you can keep up with the GBKM network in various ways. You can continue to watch us live and listen live 24/7 at www.gbkam.tv or www.gbkam.fm. Make sure you download our free app, the GBKM app that's available for all iOS and Android devices, so you can stay up to date with us and you can take us on the go. You can also continue to watch us on Facebook and YouTube at GBKM Network, where you can like, share, comment, subscribe, let us know what you're thinking. You can also follow us on Instagram and Twitter at GBKM Network, where you can stay updated on what's going on right here at GBKM. And you can continue to follow me, your host, Elizabeth Aloidi, on Instagram and Twitter at TIS_Liz_O for more updates regarding the Chat Up show. And with that, stay safe, stay healthy, and I will see you the same time, same place next week. Take care.
The bad news is that everyone is a potential victim. But the good news is that everyone is a potential solution. Sensitize the masses to sanitize. Keep a social distance and quarantine. Stop! The coronavirus is sweeping over mankind. Everybody must be alert. It's a global pandemic we can never take for granted. Kila mtu must be alert. It's a matter of life we can never take for granted. Discipline and personal hygiene, and make sure you regularly wash your hands. Keep a distance from everyone. Report anything like a symptom. Serious fever is a symptom. Dry cough is a symptom. Walkway tamula is a symptom. Itchy eyes and flu is a symptom. Kumo butabusiga, wejemu batanalwala, omoyo gwe gwanga.